Hello, this is Dr. David Green, CEO of the Colorado Pain Network. Today the topic is what you need to know about fibromyalgia. What exactly is fibromyalgia? A connective soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents multiple tender spots on the body that are primarily found in the back, neck, chest, hips, arms, and legs. Previously, it was referred to as a chronic pain syndrome, psychogenic rheumatism, and fibrositis, although now it's routinely referred to as fibromyalgia. Over 3% of women in the U.S. and 0.5% of men have fibromyalgia. Typically, the age range is 30 to 50, and 3/4 of those with fibromyalgia actually go undiagnosed. How do you know if you have it? The American College of Rheumatology has put out some guidelines. History of several areas of aches or pain for a minimum of 3 months. Have at least 11 of 18 locations on the body that are significantly tender. And you can see the red dots that show those areas of tenderness that have been identified. And if it's close but not quite meets the definition, it's called myofascial pain syndrome. And incidentally, it gets the same treatment options. So the JAMA guidelines from 1987 have major and minor criteria. Major include generalized and chronic aches and pains or stiffness present for over 3 months in 3 or more anatomic regions, multiple tender points at characteristic anatomic points, no other identifiable condition that the symptoms represent. Minor criteria include generalized fatigue, chronic headaches, neck and shoulder pain, sleep disturbances, bowel irritability, and subjective numbness and swelling. Oftentimes, it's simply a diagnosis of exclusion. You work through the differential diagnosis to see what it could be, and if it doesn't quite meet any of those and it fits, close to the definition of fibromyalgia, or fits it, then that's what it's identified as. What are the treatment options? Well, there's a lot of alternative medicine options available, including acupuncture, chiropractic adjustments, physical therapy, massage, aromatherapy, homeopathic medicines, spa baths, relaxing herbals, music therapy, and yoga. All of these have been identified as potentially effective options for those with fibromyalgia. When you start getting into medications, there are antidepressant medications that may be helpful, analgesics, such as nonsteroidal anti-inflammatories, muscle relaxers, acetaminophen, basically Tylenol, opiate medications, membrane stabilizing drugs such as Lyrica or Neurontin, sleep aids, and then Myers cocktail, which is an IV infusion of a lot of natural vitamins and minerals, has been shown to be beneficial. Now, all of these are not typically indicated for each patient. It's a matter of, a little bit of trial and error with individualized regimens. There are a few FDA-approved medications for fibromyalgia. One of those is Lyrica. That was the first FDA-approved drug in 2007. That was followed up in 2008 by Cymbalta. And then in 2009, Savella became FDA-approved as well. All of these really have an unknown mechanism of action. That's really comforting, isn't it? That we don't know how they work, but they work. How well do these treatments work? The Myers cocktail had a 2009 pilot study in which most subjects experienced relief as compared to baseline, but no statistically significant differences were seen between the IV therapy and placebo. So it is widely used because it's really minimal risk and potentially high benefit. There is really no cure, and it's a challenging condition. There are some new studies showing patients can decrease symptoms dramatically through multimodality treatment. And what that means is you might be tolerable of physical therapy, massage, medications, maybe the Myers cocktail. So it might not be one thing that gives you the benefits, but several. The top pain management clinics in Colorado are Colorado Pain. They offer comprehensive pain management, including both medication management and interventional treatments. A lot of what we discussed they offer at Colorado Pain. There are several locations, including Metro Denver, Golden, Buena Vista, South Granby. They accept over 50 insurance plans. The doctors are board certified and have won the Patient's Choice Award 5 years in a row. The number to call is 720-306-9575 and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.